Hey, this is Kevin Landrigan at the Nashville Telegraph and LobbyNH.com. There was a report last week, an important report regarding one of the most significant issues this legislature will tackle this year, and that is whether to expand the Medicaid population. You may recall in the Federal Affordable Care Act, the so-called National Health Care Law that President Obama signed, that states are permitted to decide on their own, thanks to a Supreme Court decision, whether they want to expand Medicaid eligibility up to 138% of poverty, which is just about double the eligibility right now. Consultants report the Lewin Group had already concluded that the state could expand its Medicaid population to cover as many as 70,000 more people, which isn't quite double, but it's about 60% increase in the Medicaid population. The report this past week essentially said, here are the winners and losers if you expand Medicaid versus if you don't. And one of the interesting stories is hospitals actually lose money if you expand Medicaid, which seems kind of counterintuitive, but here's why. The Affordable Care Act requires everybody to get health insurance. So many of these folks who are low and moderate income are going to have to get health insurance or pay a penalty to the federal government. And in New Hampshire, our reimbursement rates to Medicare and Medicaid, the federal insurance programs, are relatively low compared to other states. Our reimbursement that is paid under commercial insurance is higher. So this essentially says many of these 70,000 people are going to have to get commercial coverage if you don't expand Medicaid. And when you do, that's actually going to give hospitals more dollars than if you expand Medicaid. What's the prognosis for that here in the legislature? Governor Maggie Hassan is a strong supporter of expanding Medicaid. She'd like to make some tweaks to the program, certainly, and she'd like to see the federal government pony up more money to states that do expand Medicaid. But she supports it. I think the democratically led House of Representatives will support it. This really rests with the state Senate. It is very narrowly Republican, 13 to 11. And it'll be interesting to see what they do. I think in the main, some kind of expansion of Medicaid is probably likely. It's only going to take a couple of Republicans to support that kind of decision. And certainly expanding Medicaid would provide more people with health care. But it's going to be a bitterly fought issue, and it's certainly not decided now. We'll see in the next couple months.